Hey everyone, and welcome back to another explainer. Today, we're pulling some incredible insights from Kinexa and Dr. Christophe Delong to take a high-energy deep dive into a totally hidden foundation of your body. It's this structure you probably never ever think about, yet it's literally carrying the weight of your entire world. It's the ultimate unsung hero of your anatomy, just quietly operating in the shadows until the exact moment it breaks down and screams for your attention. Now, if you've been battling chronic lower back pain, you know firsthand just how frustrating it is to search for a solution. It's like a giant mystery waiting to be solved. You've probably been told it's a herniated disc or, maybe just bad posture. But what if you've been blaming the totally wrong culprit this whole time? I mean, what if the real issue isn't even in your spinal discs at all?
Okay, let's dive into this. Here is our roadmap to demystifying your pain today. First, the forgotten pillar. 2, why it hurts. 3, secret biomechanics. 4, sex, age, and variations. And finally, how to fix it.
So, Section 1, the forgotten pillar, the foundation of your body. It turns out the sacroiliac joint, or SI joint for short, is that strategic intersection right where the base of your spine, the sacrum, wedges into your pelvis, the iliac bones. Now, unlike your knee or your shoulder, which are perfectly built to swing and rotate, the SI joint is a wedge held together by literally the most powerful ligaments in the entire human body. It prioritizes massive stability over mobility, so it only moves about 1 to 3 millimeters. And this brilliantly illustrates its 3 vital superpowers that keep us moving. First up is transmission. It transfers the entire weight of your upper body directly down into your legs. Second is shock absorption. Acting kind of like a car's suspension system, it absorbs the impact of every single step you take so your spine doesn't just shatter. And third, specifically for women, it actually adapts during childbirth. It uses hormones like relaxin to temporarily widen the pelvis. It is an absolutely incredible piece of biological engineering. Moving right along to Section 2, why it hurts when the system breaks down. So, SI joint pain usually stems from 2 completely opposite extremes. On one side, we have hypermobility. This is when the ligaments become way too loose and unstable, which is incredibly common during pregnancy because of that relaxin hormone we just talked about. But on the exact opposite side, we have hypomobility. This is when the joint gets totally blocked or jammed up due to excessive tension, maybe terrible sitting posture, a bad fall on your tailbone, or even something as simple as having one leg slightly shorter than the other. Think about your own daily habits for a second. Which category might you actually fall into? Now, what's really interesting here is how we can treat these symptoms like a detective's clue board. We see some stark differences. If you have an L5-S1 herniated disc, the pain is usually central and it shoots all the way down your sciatic nerve, right to your foot, especially when you bend forward. But if it's your SI joint, the pain is usually off to one side, mostly in your glute or lateral lower back. That pain typically stops right at the knee, and it's triggered most when you put your weight on a single leg or twist your body.
All right, Section 3, secret biomechanics, the stealth movements.
What absolutely fascinated me here is a stealth movement called nutation. Nutation is a totally natural, microscopic, forward tilting, or like a nodding movement of the sacrum. It is literally your body's ultimate safety lock. The moment you stand up or lift something heavy, your sacrum tilts forward, completely locking the pelvis into an incredibly rigid, stable block. But if this invisible nutation movement gets locked, well, the safety lock fails, and your lower back muscles have to desperately overcompensate. That's what leaves you in severe pain.
And hey, we really can't talk about hidden mechanics without bringing up the psoas connection. The psoas is the only muscle connecting your upper body directly to your legs, and it passes right by the SI joint. It's actually famously known as the stress muscle of the soul. When you're mentally stressed out or you just sit at a desk all day long, your psoas shortens and gets super tight. This physically pulls your pelvis right out of alignment and twists your SI joint. So yes, your mental stress quite literally becomes physical joint pain.
Let's move to Section 4, sex, age, and variations, life's impact on the SI joint. So a really crucial point here is understanding how this entire area functions during intimacy. During a sexual encounter, the actual back and forth movement is generated by the highly mobile lumbar spine. But that L5-S1 lumbosacral hinge, it acts as the central pivot point between the lower back and the fixed pelvis. This means it takes the absolute harshest mechanical punishment, which is exactly why people often complain of a central bar of pain after intimacy. Meanwhile, the sacroiliac joint itself isn't generating the movement at all. It acts much more like a shadow stabilizer, just managing the opening of the hips. If you end up twisting the SI joint by using wide leg angles during intimacy, especially if your joint is already a bit rigid, it can trigger a really sharp, isolated pain right in one single glute. Ouch.
But don't worry, staying active doesn't mean you have to endure a mechanical nightmare. As Dr. Christophe Delong wonderfully puts it, the activity is a question of technique, not sacrifice. The movement comes from the legs, the stability from the pelvis, and the back, it just follows the journey. You can actually fix this by using a modified Amazon position, basically squatting flat-footed to engage the thighs and glutes, or simply using your hands to offload your body weight. This keeps your back in a neutral, safe posture.
And speaking of anatomy, absolutely no two SI joints are the exact same, especially between the sexes. A female pelvis is naturally wider with smoother joint surfaces. It's built evolutionarily for mobility and childbirth, which unfortunately means a much higher risk of joint instability. Conversely, the male pelvis is narrower. It has rougher surfaces and thicker ligaments, built for pure strength. Because of this, men are much more prone to debilitating stiffness and even complete bone fusion as they age. This dimorphism is exactly why any physical therapy treatment you get must be entirely personalized to you.
Finally, we reach Section 5, How to Fix It, Taking Back Control. Before diving into treatments, physical therapists often use something called the Genslen test, and you can actually gently try a variation of this right at home. Just lie on the edge of a bed, pull one knee tightly to your chest, and let the other leg drop off the edge into the void. If that dropping motion triggers your familiar sharp glute pain, well, the SI joint is highly likely to be the main culprit behind your suffering. Once you've identified it, the really good news is that 80 to 90% of SI joint issues can be fixed entirely without surgery. We just use conservative strategies. It all comes down to restoring balance. You need to strengthen your core, your glutes, and your pelvic floor. You need to stretch out that tight psoas and the deep glute muscles like the piriformis. And you absolutely must correct your daily posture. Stop crossing your legs and stop standing with all your weight lazily shifted onto one hip. Finally, apply some heat to relax those agonizing reflexive muscle spasms.
Wow, we've covered a tremendous amount of ground today, peeling back the layers of a joint that silently supports your every single move. So I'm going to leave you with this final provocative thought. The next time you feel that ache, ask yourself, is your lower back pain really coming from your spinal vertebrae, or is your forgotten foundation finally crying out for some structural balance? Take a hard look at your posture today and give your unsung hero the support it actually deserves. Thanks so much for joining me on this explainer, and keep learning.